Hello guys. My name is Pascal Ago, popularly known as Pascal Talks. You're welcome to my YouTube channel. So today we're going to be talking about caregivers and CNAs, popularly known as nurse assistants. That is certified nurse assistants. Now we're going to be talking about the two. We're going to compare and contrast, and I'm going to tell you at the end of the day which surpasses the other, which you should go for, and which one. I'm not actually discriminating against the two, but I have to compare and contrast so that we'll bring out the best out of the two. Now you can attend any of these courses, but I have to tell you the truth that one supersedes the other. You understand? The reason is this: you can actually become a particular one while attending the other one. So guys, join me in this video so I tell you more. Remember to give this video a thumbs up if you like it, so we can get to tell you more. We can get you more details on these particular issues or issues like this. On this channel I post 2 times a week at least. Sometimes I post 3 times. And then I have to tell you this: I do more things about Dubai, and I update you about what happens in Dubai too, and every other place. Once in a while you're going to be seeing a vlog of my personal life or things that I think or how I think them. Thank you guys, and let's move on. Now I want to start with caregivers. So guys, what do you know as a caregivers? What do you think a caregiver is? Caregiving. Care and giving. It is a simple term that comprises of 2 words: care and giving. Now, caregiving is a short course that you can study here in the United Arab Emirates in Dubai. It is actually KHDA approved. Most of them. You have to be careful about that because some of the institutes are not KHDA approved. So you need to be careful about that. Caregiving actually is a course that actually prepares an individual, or rather, let's say, makes an individual a medical personnel, teach them how to give care to people, mainly the elderly, infants, or sick people, whichever it may be. Now, where do these caregivers work? They can work in places like old people's homes. Yes, old people's home, the one the one they get to send maybe your grandmother or grandfather when they are old and they can no longer take care of themselves. So old people's homes, you can see caregivers working there. Most of them are being managed by agencies, you understand. And then there's another one that some of these are agencies, health agencies, or home care agencies, or healthcare agencies as they are popularly known. They can as well send individuals to the homes, private homes of the people who need their elderly ones or elderly people being taken care of. These caregivers can also work in private homes as caregivers for infants or newly borns. That's newborn babies. So that is it. Those are the places they can work. And at the same time, the act of caregiving entails many things. That is why they need training. That is why these guys, they need training. For you to take care of a sick person at home, or an elderly man, or an infant, you need a lot of training. You understand? You need to know how to bathe the baby, how to bath the baby. So in case the baby is choking, you know what to do when they are choking. Or a little baby faints, you know what to do. You know how to give them like CPR or stuff like that. So guys, caregivers, they work in old people's homes, in private homes, and they can work with both elderly people, infants, or sick people. You understand? So their price range for the salary can actually go for, let's say, from 3,000 dirham till about 6,000 dirham. You understand? So for the training, guys, it depends on the institute. It depends on the institute the person is actually going for. There are institutes that I know about. They go as low as 1,500 dirham, and you can pay on installments. Yes, and they are KHDA approved. And there are other institutes that actually they go as high as 3,400, 3,500, and as much as almost 4,000 dirham. Now I'm giving you a range from 1,500 dirham to about 3,500, 3,008 dirham, 800 dirham, or thereabout. So that is what I'm using, the United Arab Emirates, guys. So in case you are listening to this video and you are not, you don't use the United Arab Emirates currency, if you don't, you can as well try to change it in your own currency. So guys, that is what it will cost one to get trained for a caregiver. Now caregivers, I've told you where they can work, what they are expected to learn to do. They need to learn, how to help a baby in case a baby burps or it's eating and burps. They know what to do. For the old people, you learn to care for them, support them. Caring for the old people, I'm not going to lie to you, it is going to range from helping them stand from the bed, wake them up when it's time. It's just like taking care of a baby, just like that, typically. So to the extent you actually can be the one helping them to go to the loo, that's to the toilet, help them out. They get there when they're done, you can help to wipe them. Yes, it is to that extent. You can help them get to clean them up, get to help them bathe if they need the help. But the main thing is actually to get to help them out and not be the one doing it. Don't push to do it. You can look at supporting them. The main thing is to look at supporting them and not being the one to take over everything. If they can do some things, you let them do it. You are only there to support. You're only there as a supporter. You understand? In that case, you can also be called or termed a personal support worker. You understand? Or a personal care assistant. So those are the other parts. We talk about that in other videos. So those are the things you are expected to do for the elderly, for the sick, and as well as for the baby you are taking care of. You can as well help in preparing their meals, giving them their medications as required. It takes to some extent, if you're trained to do so, to some extent, you might be taking their vital signs in the sense that, which entails about the temperature of the body of the person, the breathing level, you understand? That's like the pulse rate, the heart rate, everything, the sugar levels and stuff like that. So it can get to that level. Those are the things you expected. You can actually be expected to do the nails of the person, or they take care of the hygiene of the person, the nails, the toes, even to the extent you can be the one washing their hair and doing their laundry. You understand? And sometimes you are expected to even help in picking up. Maybe it depends on the agency you're working with and with the family you're dealing with. So you might be told to go and do a kind of a shopping for them, depending on their diets. You understand? So that is why you are trained for that. That is why you are certified for that. Now, guys, I'll move over to the CNAs. Which is Certified Nurse Assistant. So Certified Nurse Assistant, here the person is trained to assist a nurse, just like the name sounds. Just like the way the name sounds, Certified Nurse Assistant. Now you're trained to become an assistant to a nurse. So where the nurses work, most nurses work in the hospital, in the clinics, in schools, in private homes. Yes, they do. They do have private nurses. So it depends on where you're working. Now, these nurse assistants are trained specifically to just help the nurse. They do the jobs delegated to them or given to them by the nurse in the hospital. Nurse assistants are not expected to take directions or orders from the doctors. If you must, then there must have been an agreement between you and the establishment you work with, or between you and the supposed supervising nurse whom you work under. So if such happens, then know that you are permitted to do so depending on the establishment. So guys, like I said, nurse assistants can work under a school, a hospital, a clinic, a private home, depending on where they are posted. So some of you might actually get to figure it out already. What do you say? That nurses or certified nurse assistants actually have more places or more options than caregivers. Now, what am I trying to say here? Caregivers, like I said, you never heard me mention that caregivers can work in a hospital or clinics. No, they cannot. And most of them can't even work. They're not allowed to work even in schools. So they can only work mostly in private homes or home care agencies, healthcare agencies, or private homes mostly. So they are kind of restricted. The caregivers are restricted to those areas or to those parts. You understand? So nurse assistants are the ones who are certified and trained to work either in the hospital, in the homes, in the healthcare houses or homes, in anywhere. So judging by this, you would know that nurse assistants have more advantage over the caregivers. Now you must have known that caregivers cannot perform the functions of CNAs or nurse assistants, but nurse assistants can perform the jobs or duties of a caregiver. You understand, guys? Now, Judge by yourself, meaning the nurse assistant is better and bigger than the caregiver. Now, as a caregiver, you are trained just to take care of people in their homes, the elderly, the sick ones, the infants, that's the babies. It can be in a particular home where they actually brought maybe people who got accidents or and are being rehabilitated, maybe people who actually got some sickness and they're trying to revive them or put them back to their normal way, or you know, old people maybe in an old people's home where they get to retire, grandmas, grandpas, and stuff like that. And then you can also work in private homes where they give birth to babies. You understand? So those are the things. Now, let's go back to CNAs, which are nurse assistant. The nurse assistant has a variety of things in which they are taught. That is the reason why they get to work with the nurse. Now, it is not difficult. If you just put your mind to it, you will know. Nobody's going to teach you any medical calculations, any medical words, or medical this, that. Although, yeah, there are some terms that you will be taught to know how to pronounce them, to know in case the doctor says something or your supervising nurse says something. So you'll be taught on some things. You are not necessarily needed to cram it or know everything. You understand? You can still ask questions, and believe you me, when you keep or start training, you will get to know more about it. So guys, there are things you need to know, things you need to be taught when you are a CNA. When you want to become a CNA, that's a certified nurse assistant. When you're training, you'll be trained on things like what to do and what not to do, the places you are allowed to act and places you're not allowed to act. For instance, a CNA or a nursing assistant is not allowed to do anything that is out of the scope of the health plan of whomever you're taking care of. What am I saying, guys? You're not supposed to do anything out of the health plan of whoever you're taking care of. Let's say, for instance, guys, in the health plan of a client in a hospital whom you are in charge of, it is stated that so client, a particular client, should be given an injection at a particular time. A CNA is not allowed to give any injections. You are not allowed to inject a patient. Only nurses can perform such things. Now there are some laws guiding you, some laws that will tell you what to do and what not to do, where to say yes and where to say no. Those are the first things you will be taught, the laws and policies guiding a CNA, a certified nurse assistant. Now guys, some other things that you'll be taught or trained on are things like types of bandaging. Bandages for people who actually have injuries and stuff. You understand? You'll be taught on how to bandage people's hands. The bandages you see for the head, for the wrist, for the hands or fingers, for the hips, for the chest. They all have different set of names. That is what you'll be taught on that. I'm not going to go into details, guys. I just want to list and tell you things you should be expecting to learn. You'll be taught all those, the names and how you can tie them. There are elbow kind of bandaging and stuff like that. The ones for the head, the ones for the scalp, the ones for the chest, all those, the one for your ankle, wherever you have an injury, there's a type of bandaging required for that. Now, you'll be taught the kind of bandages, the names, the measurements and stuff like that. Things like that you'll be taught about, so you get to know. You get to know how to tie at a particular place in case someone is injured wherever they are injured. You understand? So guys, that's one of the things that you'll be trained on as a certified nurse assistant. The next thing, guys, is wound care. Wound care. Any form of injuries or wounds, dressing of wound. Dressing of wound entails an already existing wound, and then you take off, say, the plaster and whatever is used to take care of, to cover the wounds, take them off, clean them off with the normal solution, the usual required solution, and then you dress them back and cover it back. You're going to be trained on that. Yes, as a nurse assistant, those are your duties. You're going to be trained on things like hygiene, things like bed making, making the bed of your patient or whomever you're taking care of, making their bed either when they are on it or when they are out of it. Yes, guys, You can make the bed when somebody is lying on it while the patient is lying on it. So you can be you will be taught on that. Things like occupied and unoccupied bed, open and closed bed making. So you can be taught on that. You keep that in mind. Those are simple things mainly. It's all about training. It's less about writing, reading. It's much about training. Now, I would advise for some guys that who do not like too much or so much reading, you can maybe go for the caregiver. Then if you can, you go for the certified nurse assistant. That is a really nice one. And then after being trained and certified on that, you can as well work both as a nurse assistant and as a caregiver. You understand, guys? And for the payment, for the salary of a nurse assistant, it ranges from between 3,000 dirham, or you can say between 4,000 dirham to about 6, 7, or 8,000, depending on the person's experience and depending on the institution or the establishment where you work. So that's it. That's about it. Now then, for the tuition, for the course, it's actually ranges from almost the same as that of caregiver, which is from 1,500 dirham to about 3,500, 3,008 thereabouts, almost 4,000, depending on the institute you are attending it with. Yes, guys, it depends on the institute, and most of them actually run installment packages. So you can pay on installments while you attend the classes. They also have classes for weekends. They have for weekly, maybe 3 times a week, depending on your schedule with them. You have to talk with them and then make the plans. Now, guys, before I continue, I need to let you guys know you don't need any background studies in the medical line or in the medical field before you can actually attend any of these courses. Although if you actually have that, that would be a plus. It will be a plus for those people who are actually coming in here. It will be good for you to acquire these. If you don't have them before, you acquire it so you can actually get that KHDA approval or accreditation. So what are the things that are actually needed for you to register for this course? If you have an Emirates ID, that's your resident ID card, it is needed. You can use it. But if you don't have that, let's say for instance you just came into the country and you desire to go for the course. Now you have your international passport. Your international passport can go for it. You can make do with that. So there's no hindrance in case you are not a resident of the country yet. So you can go for it. And the duration for the course, for both of the courses, are actually currently 4 months. If you are attending weekends, let's say we have Friday classes, you actually have 4 months to complete the course. Now for that of caregiving, they can actually get to if you have the time, they can do it in 2 days for you, 2-3 days for you. If you have the time, you use 2 or 3 days to complete the course, and then you get to sit for your exams. Yes, guys, there are exams for that. You have to sit for a test at the end of it, in which you're going to be graded with. That is what will determine if you actually learned what you're trained for, what you've been taught, and then that determines if you'll be certified or not. Yeah. So at the end of the day, you sit for a test and then you get your certificate. So guys, for those people who are actually asking if it is possible to get to use these certificates abroad, yes, you can. You can use it abroad, but then you need to get to attest it at the Ministry of Foreign Affairs here in the United Arab Emirates before you can use it abroad. Right? Then some of the functions that I want to put down more, I want to talk about more functions or things you're going to be trained on as a CNA, as a nurse assistant. And those are the vital signs. Vital signs. You're going to be taught on how to take the temperatures of your patients, the heart rate or heartbeat, the sugar level, and then take them down and get to write them down, record them whenever you take them. It depends on the time, depends on the instructions given to you by the nurse. Most time these instructions are given in place of a written record of the patient, normally kept close to the room or the bed of the patient. You understand? So those are the things that you will be trained on. Those are the things that you need to know. So guys, that's about it. For me, if you ask me, I prefer the CNA course to the caregiving. Now, I'm not saying that for you to do a caregiver course that you are not recognized. You are very well recognized. The only thing I'm telling you is for you to know. I educate you to know which one is better and which one provides you with more options. A CNA can work as a caregiver, but a caregiver cannot work as a CNA or as a nursing assistant. So it's preferable to go for the nurse assistant course if you can. So guys, if you are watching this video now till this end, that means you stayed till the end. Thank you very much, and we thank you for always coming back to this channel. Now, if you haven't subscribed to the channel, kindly go down, please go down and click on the red button, subscribe. Remember to give this video a thumbs up. Guys, when you give a video a thumbs up, it gets to make YouTube to get to put up or suggest this video for other people who need the information. So if they get to do it, we are growing. And the more we grow, the more I'm able to give you more information. So guys, I post on this particular channel every week, 2 or 3 times a week. And I get to put up things like informations on Dubai, informations about visa, informations about the United Arab Emirates. And I go as far as telling you what to do, telling you the courses to get to do. In case you have not listened to it, I'll be tagging a video up there. You get to listen to it and get to know the courses, other courses you can do that are not medically related. It can be barrister, it can be security course, it can be CCTV camera operator, other things, safety officers, and so on. I'll take the video here so you can go and check it out. Also check other videos out, and from time to time I'll be posting here a video of my daily activities just to know what you like so I can give you the best. Thank you guys. Please share this video and let